So hi Dr. Varun, it's been a sensation actually having you at the World Implant Expo, and I'm very excited actually to have a small conversation with you. So tell us something about yourself.
Thanks, Dr. Nitin. It's been fun being here. It's been an outstanding 3 days in Kochi. I had to come in a little bit late. Our group was organizing a marathon. So on Sunday morning, we organized a marathon for 10,000 people for charity. So we finished that, woke up at 2:30 in the morning, got the marathon out of the way, and then of course had the after party, very important. And after the after party, I got onto the flight, got in over here on Sunday, but I was here all of Monday and today is Tuesday. And so far it's been fantastic. The response has been great. I think it's been a lot of open sharing, so that's what I really liked about it. You asked me about myself. I'm first and foremost a huge nerd. I love my computers, I love my tech, I love geeking out on various things. I teach my 7-year-old daughter how to replace hard disks in computers, thinking that this is a useful life skill. It may be not, maybe it is. But it's generally, that's my first love. I would say tech is number one. Dentistry is like a hobby on the side. No, but dentistry of course is a very serious profession. So I used to be a Linux developer actually in 11th standard, 12th standard, and then up to second year of dental school, and then it got too serious in dental school, so I had to quit. But I always liked that side of what I did. But then dentistry, of course, is what pays the bills as well. But I do enjoy dentistry because especially when it presents with certain challenges, that's what makes things exciting. And that's why having a lecture or an entire conference based on complications is right up my alley.
Right, thank you so much for that. Now, you saying that you've been a tech savvy, I think it's brought to you to a platform on Instagram where you've been a sensation in India for the youngsters, a lot of dental students and even the practitioners who look up for you. You must be having around 45,000 followers on Instagram, which is a very big thing for someone to come to that stature on a social media. So what brought you to Instagram, and what exactly was the idea to post things? Because I've seen things which begin from simple dentistry to some complicated things in our day-to-day practice, and you've been a great influencer all throughout.
Yeah, so I don't think you need to be tech savvy to get onto Instagram. Instagram has a little bit of a learning curve, but it's not like a very, very absurd, large learning curve. So I don't think tech savviness is actually a big role to play in that, because a lot of people who are not tech savvy also do well on Instagram. But I think essentially what we need to look at if someone is looking to grow their following is to just share information. I think share what you know. I think everyone has something useful about what they're doing in dentistry or even outside dentistry. And I think that is what needs to be shared, and that's how you grow your following. So I would implore everyone to start giving out useful information. The problem is people are also very protective of that information. They think it's very exclusive information. But what are you going to do? You're going to take it to the grave? This makes no sense. Okay, so you build up your Instagram following, and then also it becomes easier to, let's say, sell courses. If you're conducting private courses, it's easier to sell courses where you can share that information in more detail. I don't think anyone is going to lose a student, like a mentor is not going to lose a student because they shared something on social media as a tip or something like that. I think it only enhances the communication they have to potential students as well. So I think a lot of people look at Instagram the wrong way. I just look at it as a marketing tool. Yeah.
It's very generous and very kind of you, doctor, to get into that platform and help all of us. That brings me to our next question. You've been a practitioner yourself, and you've practicing in your mother's clinic.
That's right.
Who's been one of the top endodontists in the country. So how is it like having an endodontist in your clinic, and whether it's an easy thing or it's quite a challenging thing to follow her footsteps?
So I'll have to correct you there. She is an endodontist. She probably does one root canal every 10 years. So she doesn't really do endodontics. She does more cosmetic dentistry and implant dentistry. That's her main everyday thing. And it's very useful to have her in the practice because generally we agree on most treatment plans. There are certain occasions where I might have a viewpoint and she might have another viewpoint, and then we kind of debate it out, and only once one of us relents, either I should say I'm fine with what you're planning, or she should say I'm fine with what I'm planning, and then we see, okay, we do a compromise and then we go ahead with the plan. Because if we can't see eye to eye on something, we'll take a third person's opinion. Maybe we'll ask Dr. Shankar. something like that. But we get along very well, especially when it comes to treatment planning. So it's very nice to have this platform, which is an already established clinic, to do my work, because then I don't have that stress of starting a new clinic,
Right.
so to speak. But of course, there is the stress of being a second generation dentist, where people have high expectations from you already, and they will always compare you to the previous generation. But that's a discussion for another day.
Right. So, I think a part of your education was in India, and a big part of your education, your post-graduation, was in the US.
That's right.
So, when you look at the quality of education between India and the US, what are the differences you've seen between the Indian system of learning and the learning process in the West?
I think the major difference is actually the way you interact with your professors, right, with your teachers. Here there is, I don't know if it has changed. I'm sure it has changed in many places, but over here there is a lot of fear in the colleges to your HODs and to your professors and all of that stuff. And over there, you are invited to openly challenge your professors and your HODs, with whatever concept. If they say that this concept, you can go and say, I read an article which is the opposite of what you said. Why is that so? And then that will be something which your HOD or your teacher would be very happy to explain, and would in fact be happy that you are challenging them. Versus over here, when I talk to the postgraduates over here, the HODs and the other faculty, many of them feel threatened by this question coming from this. They think it's like a sword fight, like a battle to the death, which is not what it is. So I think that openness in education is very important, and it's not so much rote memorization over there. A lot of it is how you apply stuff. So
Right.
It matters a lot.
So, having your education abroad with implants and placing implants and practicing implant dentistry in India, what do you feel are the differences between the way implants are practiced in the West and what's been done in India?
We're much better off here. The education wise, I did prosthodontics and maxillofacial prosthodontics, which has components of implants in it, large components actually, in the programs which I went to. But the major difference between between India and the US in terms of private practice implant dentistry is, in the US, it's way more aggressive. If there is a tooth with a slight furcation involvement, we'll try to hold on to that tooth for many years, keep it clean. Whereas there's a huge tendency to remove a tooth and replace it with an implant over there. And time and again, we have seen that implants are not better than teeth. Implants are not teeth, they're replacement for teeth.
Exactly.
But they are not teeth themselves.
Right.
Yeah.
So, where do you see India going 10 years ahead from now on with dentistry, comparing to the West, where dentistry has gone quite advanced compared to some segments in India?
I don't think there's a major difference right now between the West and India. Whatever you get in the West is about 6 months away from launching over here, sometimes less, and sometimes we get things first, So there is no more any kind of barrier or difference as to what is available. It's a different answer when, if you ask me what are people willing to do, a lot of people don't want to spend on, like new equipment, because they are very price conscious. But because of the sheer number and the sheer volume of dentists in this country, you're still going to have people buying those equipment. Even if it's a small percentage number, the actual number is quite big, because just of the number of volume. So I don't think we're anywhere different in terms of dentistry technology being available in India versus abroad. There's hardly any difference.
Okay. So, Doctor, let me just quickly jump into some diagnostic things about implants. This has been some questions being posted for you, and on special request that I'm asking you these questions. So, do you have cases where sometimes beyond a CBCT that you need some investigation to view the bone quality, where you can remember or recollect?
No.
Everything gets covered with the CBCT?
What I need has usually been covered with the CBCT. Especially for implant planning, I don't think you need anything more than a CBCT. In fact, the CBCT is preferable for many reasons compared to a medical CT. So, CBCT is where it's at for us.
Okay. And can you name some blood investigations which are a must, 3 blood investigations probably, without which you wouldn't never place an implant?
Well, I want a CBC with a differential count. I want vitamin D, because after COVID, we started seeing failures, and then we realized because vitamin D was something which is deficient with these patients who never stepped out during the whole lockdown period. So vitamin D, and then of course I want PT-INR, because I don't want the patient to have a bleeding issue during surgery. So if you ask me my 3 favorite tests, that would be it. CBC with diff, PT-INR, vitamin D.
Right. So implant under GA or implant under LA?
Depends on what indication is there for GA, right? But we do a lot of conscious sedation. We do midazolam conscious sedation, works perfectly well. We don't do nitrous because the mask is a little bit cumbersome. Nitrous is okay for kids, but the mask is a little bit cumbersome. And if there's a leak, everyone's on the floor because the nitrous is leaked into the room. So that's not what we think is very safe. Of course, there are ways to do it very safe, but still the mask is an obstruction, which we would rather avoid. So we prefer midazolam, and it has worked wonderfully well for us in terms of giving high quality, pain-free, stress-free care to patients.
Right. Just to end this whole session, and then just what do you do in your free time whenever anything other than dentistry? How do you spend your time?
Well, I have 2 little kids.
Okay.
And of course, my wife, and today's our 10-year anniversary, and I'm here doing this interview, and so she's very tolerant of all my nonsense. So I have to thank her for that.
That's so nice. So we can end with this note on your Instagram, like how you say we've confused enough.
Yeah, I hope I've
could say
confused
that.
you enough. This is the
There
Dental
you go.
Review guy signing off with a smile.
Thank you so much.